Hey, it's Dr. Sloan, better known as OrthoDoc, and this is not medical advice, but it's some helpful hints. How about that? Let's go with that. So today we're talking about hip bursitis. I had one of my followers, someone that I know, actually ask about hip bursitis. And so this picture is basically the pelvis, if you will, where your hips come down, and then you see the femur, the ball and socket, and the little bumps on the side of the hip joint is called the trochanteric bursa. The trochanter is basically the bump that you guys can feel. When you push up against the side of your hip, you can actually feel that bump. Well, there's a little sac of fluid that sits there, and that gets irritated. The irritation usually happens, like when you've been working out, talk to my trainer, but also any type of movement that is moving the glutes, specifically the gluteus maximus, because it attaches to that bone. So just think, if you're moving and you're working out, it's pulling at it. And so that sac of fluid gets inflamed. And some of us are a little bit more, fluffy. I mean, I consider myself a little fluffy, that I have enough padding there. But then there's a lot of people that I see when they come in, they don't have much padding there. There's literally their skin and bones. And so that little sac of fluid does not hold them, and it's irritated and it hurts like hell. And so this is what we call trochanteric bursitis. Bursa, the sac of fluid on the the bone, the trochanteric area. Itis, inflammation. Trochanteric bursitis or hip bursitis. So the question is, what do we do for this? You should definitely see your orthopedic surgeon about this. There's only so many things, you guys. I tell you this all the time. In our armamentarium is basically do nothing. Just leave it alone. Rest. Don't work out. Don't do stairs. That kind of thing. 2, medications. You can take things like Aleve, Motrin, other anti-inflammatory. They're not pills that may be like turmeric or bromelain or something like that. And then 3rd, you can do something that's more like a gel, icy hot, diclofenac gel, which are like Voltaren. And then, heating pad, ice, whichever one, depending on what you've been doing. And then lastly, we can do steroid injections, which is actually injection into the bursa sac while you are standing and or lying down, to see if we can help decrease the inflammation. And that's what we got. Hip bursitis definitely is a real thing, and it causes a lot of pain. So if you're having issues, you definitely need to see your healthcare professional, your ortho doc. Have a great day.